And when I walked out of the surgeon's office, the news was so disturbing.
Hey everyone, welcome to the talk today, to our live stream. That was Sigrid. You just saw Sigrid's video right there, a little preview of a video that we released earlier a few days ago. Go check it out. It's an incredible story about how she's avoiding a hip replacement. She came in from out of town to get treatment with us, and she's doing the stuff that we preach, and she's seen improvement as a result. And so we've had a lot of great feedback from people calling us and commenting on the video. You can go check out the comments yourself. And people are really connecting with Sigrid's story because it's a common one. It's one that happens to so many people who get diagnosed with hip arthritis, and they're just left with, well, it's hip replacements or tough, deal with it. But there's more that can be done. And Sigrid was so gracious to be able to be vulnerable on camera with us and share that for you guys. So go check it out. Well, who's with us today? Who's here to listen about the top 5 reasons why age does not cause hip arthritis? I'm going to be talking about this today, and I want to see who's with us here. So we got Kit Kat. She says, hello, Dr. David. I just wonder if it's possible to recover to the point that one can perform a high-intensity sport like jumping, competitive dancing, etc. That remains to be seen. You know, there's a lot of variability. It's a great question, Kit Kat. Straight to the questions. Let's do this. Just to give you the answer is, if you've been doing that stuff before, that's one factor. Another factor is how severe is your current condition. And when I say your current condition, as far as like hip arthritis, or if you're here for knee arthritis or back problems as well, because they're all related, it's the same muscle imbalance. The x-rays, the imaging isn't always the full story. It's more so the severity of your muscle imbalance, because you can have not that bad of x-rays, but be in extreme pain. And it may take you a long time to recover from that, a long time meaning the better part of a year. Because you have to do a lot of work on your part, which I help people with. So if you can fix the imbalance, then you have a good chance of getting back to those activities. It just depends on you. It depends on your mindset, your past history. So go try it out. That's my best advice. Who else is with us? Cindy King is here. I remember Cindy from Odessa, Texas. Welcome back, Cindy. She's a regular here. Oh, Kit Kat's in the Czech Republic, in Prague. So cool. Thanks for checking in from Europe. We have Dr. Lyons here from Los Angeles. Hey, Dr. Lyons. Julie Parker from Australia. She's a regular with us as well. Thanks for joining us. We have a few comments here. Mina, I remember you, Mina. She says, hi, Dr. David. What are some of the signs that knee cartilage is healing? I'm able to fold my knees, but now sometimes they pain as I have chondromalacia. How to know if my condition is improving? Thank you. And then she says, I have also received my certificate from the Knee Arthritis Recovery Program. Thank you. Oh, awesome. That's so cool. And then she says, hi, Dr. David. Oh, that's the same comment. Got it. All right. So just so you know about the certificates, people in our programs, in our hip arthritis recovery program, in our knee arthritis recovery program, what Mina's talking about here is we mail you a certificate once you pass the test, because that's one of the first things we want everybody to do, is to go through the curriculum, which is anywhere from 40 to 50 videos, depending on which program you're in. And there's tests, and they're not hard. They're decently hard. You have to think, of course, but you can repeat the test. And the point is for you to absorb the information, because then you're going to be much better prepared to deal with flare-ups and to handle progressions, because you need to own this information. This is important information for you to own, to have embedded in your brain, because you're going to face doctors and other healthcare providers, family members. People are going to be telling you, just go get the surgery. Why are you screwing around? It's an age problem. Just get it done already. You get all this pushback. And when you're trying to avoid a joint replacement, like a hip replacement or a knee replacement, it's possible, but you have to have the right information. So we test you guys, and then we send you guys a certificate in the mail. And we wherever you are in the world, we're trying to get them to everywhere. But to answer your question, Mina, you need to just track week-to-week improvements. That's the biggest thing. And what you have to understand with cartilage specifically is it is one of the slowest healing tissues in the body, second only to discs in the spine, which is another type of cartilage. And so it's not ideal if you're tracking day-to-day improvements, because I'll just draw you a little graph here. Your day-to-day might look like you're getting better and then getting worse and then getting better and getting worse. But over a week, you might actually be climbing up. And so if this is 1 week, you ended up better slightly. And you have to, the way you measure better is by finding that one variable that improved, like your motion. Like if you are able to bend better, or if you could stand for longer. In the knee arthritis recovery program and the hip arthritis recovery program, we use a criteria from our phases chart. I'll get into that more as we go through today's talk. But you just need to keep tracking improvements, and it doesn't have to be a big improvement, especially because it's cartilage. It can take months to heal. And so you don't need to see a massive improvement week to week. A minor improvement is sufficient. Hope that helps you out, Mino. Who else is with us? No one seems to believe me how painful this condition is. Yes, you're right. And, especially if you have an x-ray that doesn't look that bad, like if you go to the doctor and they say, well, you have mild arthritis in your hip, mild arthritis in your knee. And especially if you're on the younger side, if you're like in your 50s, or some people even start to get arthritis symptoms in their 30s or 40s, they don't believe you right away, the doctors and the physical therapists, and they'll kind of shrug you off, because in their mind, they're looking to do a surgery, because that's the typical treatment that mainstream medicine will push you towards. But it can be severe pain. Your joint can be severely smashed, and it can be very painful. So I get you. It's possible to have a perfect looking MRI and X-ray, or very mild symptoms on their signs of arthritis, but be in severe pain. And then the other end is possible, where you can have a terrible looking X-ray, terrible looking MRI, and have no pain. So I validate you here for sure, W. Julie Parker says, the inside of my knee was painful and interrupted my sleep last night. Too frustrated with it. My other knee has been very sore below the kneecap. Sigh. Oh, so sorry, Julie. Oh, that's no fun when you can't get sleep because of that. Hopefully you're dealing with this flare up and taking the right steps. Cindy Knight King says, that was a great and inspiring show. Oh, I think she's probably referring to Sigrid's video. If you guys haven't seen it yet, go check it out. Our media team did a phenomenal job, and it took them time to compile that. So we put a lot of work into it, but most importantly, I think you'll connect with it. Don, property manager, says, love that story. Sounds just like mine. Thanks for all you do, Dr. David. Don Roman from Hammond, Indiana. So cool. Yeah, it's a connecting story for sure. Michael says, hi, Dr. David, your exercises have helped me tremendously. You are a godsend. Oh, thank you so much. I'm glad that you're able to benefit. Fantastic. I'm sorry, say it again.
They're from New Hampshire.
Oh, from New Hampshire. Great. Jacqueline is here from Scotland on Facebook. Jacqueline Chalmers. Great. Who else is here? Lori Wilson from Ohio. I remember you, Lori. You got regulars here. C. Kelly says, hi, Dr. Dave from Quebec, Canada. Stage 4 hip arthritis here. Pretty darn limited. I'm so sorry. I'm so sorry. You're in the right spot, though. Then we have Marion from Albuquerque over on Facebook as well. Fantastic. Well, guys, we got a treat for you today. We have a live program member, somebody who's in the hip arthritis recovery program. They got started with us actually from the back pain program. We have a back pain program, in case you didn't know. And we're going to bring on Joe. Come on over, Joe. And there he is. Hopefully you guys can see and hear Joe. And Joe is one of our members of the hip arthritis recovery program, and he's here to just share some of his details. I'm going to see if I can help him with anything as well, if he's got any questions. And so, Joe, let us know a bit about yourself.
Hi, Dr. Dave, everybody. I'm a retired emergency medicine doctor, and practiced for 35 years in the Fredericksburg, Virginia area, Stafford, Virginia, and then retired and then moved to Florida. My story starts around November 23. Had some pain in the left buttocks region. And, like every person in the medical field basically tries to self-diagnose yourself, which I wasn't very good at. I went multiple weeks thinking, believe it or not, that this was a piriform muscle pain. And I remember dissecting the piriform muscle in medical school. It's not very big. And I couldn't understand how that could cause all of this pain. And it progressively got worse and worse. And I basically tried to didn't have any tools at the time. Even being in the medical profession, you just don't have any of the tools. I venture to
Yeah.
say most orthopedic doctors who are dealing with pain at this particular level don't know all the tools as well. But anyway, I basically got to the point over time that I was using a cane to the point of 3 or 4 months and decided,
Jesus.
okay, I better go and see orthopedic physician. And at the time, this was in. I had a good friend, obviously, who's in orthopedics, and he suggested I
Mhm.
go see um, a neurosurgeon who specializes in just spine. And of course, he did the MRI, and unbeknownst to me, and the MRI doesn't really reflect really anything, quite frankly. Sometimes my MRI looked
Yeah.
absolutely terrible. I couldn't believe it. I'm not a physician that really basically just walked around the emergency department, did my job. I had nothing that would have caused me to have this kind of an MRI. It looked like I had been it was terrible. Anyway, of course, it
Oh.
wasn't helpful or diagnostic. And then, of course, the first thing, we go through the whole thing. I'd tried all the pain medications, mainly some,
Mhm.
Motrin anti-inflammatory. He would describe some Toradol, things of that nature.
Mhm.
Um, and then eventually that led to my first injection. So that first injection did not work. And I let that go for almost a good 3 or 4 months. They like to do them, I believe, 6 months in between. And so I ended
Sometimes
up
as short
getting
as 3 months.
yeah, I think it probably was 4 or 5 months. I'm trying to reconstruct it in my head. And so the second injection, of course, that worked maybe for about 3 weeks,
Mm.
and then I was right back to where I was, back onto the cane. I wish I would have known what I know
Yeah.
now in terms of what I could have done to do more in terms of the pain control module that you have. Because
Yeah.
I did a walker would have really worked, I think, or helped me, I think, a lot more than just the cane did. Never did do the crutches. It was always, same old thing. I don't want everybody to see me on crutches. I don't want anybody to see me on a walker. And then, it's pride. It's just a pride thing, I guess.
Yes. Oh yeah.
And so then though that led me to eventually, at this point, you know, um, schedule this. I ended up having scheduled the surgery. And at this point, it showed that I had central. I wish I had lateral, but I had central stenosis, big time, at
Mhm.
the 2, 3, and 4. And that's something that,
Wow.
looking back now, I wish I would have, had found other ways to alleviate getting the surgery. Unfortunately,
Mhm.
though, as bad as that central stenosis, and I think it's the ligament flavum. Is that the big ligament that gets real thick? Not
Yes,
being an
yes, it is.
orthopedic
And just
doctor.
just
Yeah.
to interrupt you real quick, Joe, and then I want you to continue the story because it's
Mm,
so good. Because we're talking about hip arthritis today, but so many of you guys that are watching this have hip arthritis also have back conditions like what Joe's describing, like exactly. And there, you guys don't realize how connected they are and how many times medical professionals miss the connection and they just see this as a back problem only or as a hip problem only, and both are involved. And so that Joe's going to get a little bit more to this here in a second, but go ahead and continue, Joe.
well,
You're
sure.
saying the
And then
ligaments and
so
flavum.
correct. And so then at that point, what the surgeon decided to do, and I think this was November. Finally had the surgery in November 24th. So this is a whole year basically of dealing with sciatica. And he said, "Look, this is not
Jesus.
piriform muscle." And he kind of laughed at me. And I said, "Well, I'm just a ER doctor. What do I know?" But that was the inside joke. And I basically said, "Look, okay, so it's not piriform muscle." He says, "It's just classic. It's just classic. He, classic sciatica." And now looking backward, I can understand that. But it got to the point that I just couldn't. It was just so much that the cane was unfortunately that the last thing I tried to use, and then after the 2 shots. So I scheduled it in November 24, and what he decided to do, it was
Yeah.
put a karma device in, and a karma is the best way of thinking of karma. Basically, is the zip ties, if you will. So he basically did
Mhm.
the laminectomy at 2, 3, and 4, and then cleared everything out, and then to restructure the bones and make the spine intact. Instead of having a full
Mhm.
blown hardware fix, I had what was called a karma fix, which basically is taking these zip ties and wrapping them so that they basically tighten down the lower spine at 234. So it was, in essence, it's a fixation for all practical purposes, just a different material. That's all.
Yeah.
And so that was an incredible. I mean, even though it doesn't sound like a lot, it's a lot. And I was out for 3 weeks. I couldn't do anything. And it took me almost 4 or 5 weeks to finally get back to the point where I could, get back to walking and getting back. But then apparently after, are you still there?
I am. Yep.
Okay. Oh, you went off the screen. Sorry.
Yeah, I can hear you. They're just focusing on you, that's all.
Oh, gotcha. Okay. Sorry. And then again, at about 3 or 4 months after the surgery, bam, I get hit with some left buttocks pain again. And I'm thinking, oh no. And the first thing that goes through your mind is, okay, the surgery didn't take, or something dislodged, or so I went. So I didn't quite have to use a cane at that point, but I still was walking around limping. Started to use some Motrin again to try to alleviate the pain. Didn't have any other tools in my toolbox to fix it. Went back to the surgeon. Of course, didn't do an MRI, just basically X-rayed it. And I guess it's difficult for this because you're not, when you X-ray somebody that has this particular kind of appliance in their back, you're not going to see much on an X-ray, quite frankly. This is not radiographic. Now he claims that there's some barium built into it, but I looked at it and I couldn't see it. He couldn't see it.
It's not made out of metals, what you're saying, so it won't show up on an X-ray.
Yeah, sorry. Yeah. So allegedly there's some barium apparently in it, but we couldn't see anything. It didn't look like anything different than when we looked at the previous X-ray, so that didn't help. So basically it got to the point where it just got progressively worse. I went back one more time, shot another X-ray, didn't show anything at all. He didn't really have anything else to offer other than do another shot, and I wasn't up for doing another shot. The other thing he said, well, if it's this bad in about 4 to 6 months, we might want to consider a revision. So now we're talking about 19 or 21 months after the first surgery.
Wow.
And I'm sitting here going, I don't think we're probably going to be doing that, because I just don't have any thoughts of wanting to do it. And then I found, I had actually found some videos of you a long time back and practice the posterior pelvic tilt and some of the things that you do in the program. And it's funny because when I went to rehab here in Florida, all they're doing is trying to get you up and walking. They don't care about anything. I asked 2 different physical therapists what if the posterior pelvic tilt would help me, and they couldn't. Nothing. Absolutely nothing. It was like nothing. I can't blame them. They're basically just trying to get people back to walking after rehab, and they don't really do much on the way to hands-on. So.
Right. Yeah, their focus is to get people up and moving after surgery, and they're pretty good at that. But trying to fix a root problem, that's not their training.
Right. And so after reviewing, what I saw and then at that time, I think we're at the point now where it was about a month or 2, 6 weeks before you started the formal back program, and that you had a 28-day that I had signed up for, and it was just about ready to start that. And then I think one of the members, might have been Chris or Annika, had mentioned, hey, we are going to be starting up the back recovery program. So I waited a little longer for that. And since then, it's been night and day. My pain is completely. I have no posterior sciatic pain now.
Yeah, that's great. That's awesome to hear, Joe. So we just to give you guys the like kind of our side of the back pain program and how this connects to the hip problems, the hip arthritis. So we started a back pain recovery program, and it's available right now. You guys can get into it in case that's something that you're interested in doing. And we started as a full-fledged membership program, kind of like our hip and our knee arthritis program. But it just didn't take like our hip and knee arthritis programs have. They're very popular. And so we started to sunset it and make it only a curriculum only program. So you can still get the curriculum in case you're interested. It's on our website. And we asked Joe to migrate into our hip arthritis recovery program. And the reason for that is because the same muscle imbalance that causes hip arthritis causes all these same back problems: sciatica, stenosis, central and lateral stenosis. It goes back to weakness in glutes and overdominance in the hip flexors, weaknesses in the lower abs, overdominances in the back muscles. It's just a matter of which part of your body gets affected first. And in Joe's case, it was those nerves coming off the spine and in the middle of the spine too, the stenosis problem. So you've gone through the program now, you've had some improvements, and just to kind of give everybody a point of reference of how long you've been with us and how you've seen progress, could you speak to that a bit about when you started, more or less, and then how the improvements were and your efforts that you put into it?
Yeah, absolutely. So I believe it was the program around October of 25, right? Yeah, October of 25 is when I started the back recovery program. And at the beginning, phase one, I was mainly concentrated on phase one because, again, this pain was starting to occur again. And so I immediately went out and purchased a set of crutches. But what I really found to help me was I guess they call it a rollator. I didn't really realize it was called a rollator, but it's basically a walker with the four wheels. And that was excellent for offloading. And I did that for almost probably 4 solid weeks of just every time I would get up and do the get on that walker, and then incorporated all the pain management exercises you had, basically, which was eliciting the abdominal activations and doing the posterior pelvic tilt. And it got to the point, I think after 4.5 weeks, I was to the point where I could start coming off the walker and switch to a cane. So that was the main thing that helped me initially to get me out of that initial pain. Since then, I probably spent at least a good 6 weeks to almost 2 months just doing the pain management exercises and the stretches and offloading, and not having to use any more Motrin. I had some leftover. I remember I had some leftover Lyrica they gave you, right, for neural pain. Boy, that stuff's a trip. I tried that one time when I was having pain, and I thought, no, I'm not going back to those days because it totally just makes you go crazy. But anyway,
you have no idea. I gotta interrupt you on that. You have no idea how many doctors have told me where they literally say, I took it myself and I can't believe I've been prescribing that to patients.
Oh my goodness. And then you wake up with a hangover, and there's some kind of there's a cognitive disconnect, but that's another topic. Anyway, so then it progressed into phase two, and I spent a long time in phase two because I couldn't find my abs. I mean, I wish I was a person that exercised, my entire life and took exercise and being in condition, but didn't, and so couldn't find the abs for a long particular time. That took me almost 3 months, but they were there, and once I found them, I progressed, progressively using the phase two exercises. Stayed in probably for about 4 or 5 months. I'm now currently in phase three and trying to do the strengthening parts of it now.
That's so cool. And just to show everybody what you're talking about on the picture, because this is for the hip arthritis program, and Joe was in the back pain program, but it's almost identical. So we have phase 1 here, 2, 3, and 4. And what Joe was talking about in phase 1 is where there's certain criteria that put you in phase 1. So if you're talking about hip arthritis, then these things like having day pain, night pain, 4 to 7 days per week, or stiffness in your hip that lasts more than 30 minutes, like when you first wake up in the morning, or if you've been sitting for a long time. It could be in your back too, by the way. If you can't be on your feet for more than 10 minutes, and then if your glutes don't activate, and these same criteria, we kind of follow them, but they change, and that's how you qualify to move to different phases. And the key thing about this program, the hip arthritis recovery program, is that when you're in this phase, in phase 1, there's certain exercises and treatments that you should do. That's what Joe was talking about. He was using the rollator, the walker that has all the wheels, and doing the posterior pelvic tilt, and he was figuring that part out. And then in phase 2, there's certain exercises you do here, and then same thing in phase 3 and phase 4. There's different treatments there. And that's so key for this program, because what people in the medical field miss, and what's the information that's put out on the internet, is they just tell you, do these exercises and that'll fix the whole problem. But there's no organization and clarity on when do you stop doing that exercise and when do you move on to the next one, because there's never just a one exercise that's going to fix the whole thing. It's a progression over time. And that's what's helped Joe get to this point. And it's taken Joe months, but he has had solid progress because he's fixing the root problem. And it's going to be hard to regress. I mean, you might have some flare-ups here and there, but to just fall back to square one, it's rare that happens when you're fixing the problem this way. It's Kudos to you, Joe. That's fantastic.
Thank you. Thank you.
Well, what
So,
questions do you have? Is there anything that I can
oh,
help you with? Are you stuck with anything right now in the program?
yeah, I want to ask you something, and again, this is sort of a phase. I'm going to call it a phase 3/phase 4 question. Um,
Okay.
I live in Florida, and we have miles and miles of flat, dedicated pathways, bike trails here.
Nice.
And one of the things I did for the last 4.5, 5 years is get on my e-bike and just go all over the place, ride sometimes up to 30 to 35 miles on an e-bike. Now, again, this is a pedal assisted with a throttle. And so
Uh-huh.
when I got into the program, I thought, oh my gosh, I can't get into my e-bike until phase 4. But here's what I thought based on what now that I've been in the program and haven't had a chance to ask you this directly. I did talk to Jay and I did
Yeah.
talk to Raul. Is basically that, when you're talking about phase 4 and you're talking about pedaling, you're talking about these guys that are probably hardcore bicycle people that get on, go 30, 40 miles an hour, using their quads, using all the muscles that we are not supposed to be using. I thought, just for my own psychology, I need to get back out there. And I felt
Yeah.
that if I just made a transition of using throttle, using heavily pedal assisted pedaling, that I and still try to get my glutes on the downstroke to work
Yep.
properly, brace my abdomen, I thought I'd be fine making that transition, even though I'm in phase 3. That's my question.
Gotcha.
What would you
Yeah.
think?
Yeah. So let me just make sure I have the question right. You're using an electric bike, an e-bike,
Correct.
and so it has a pedal assist. So you pedal and then it kind of it gives you an assist. And you're wondering if you can use it safely and not overuse your quads and use your glutes. Is that what you're asking?
Correct.
Gotcha.
Correct.
Yeah, I think it comes down to your confidence level and your ability to do it. And so that's one factor. And then the second factor, there's just two, is having the experience, the maturity, the like knowing when you need to stop. Because people
Mhm.
that like riding bikes, especially when you have such a nice place to ride bikes like you described, it's easy to just keep going, especially if you have an
Mhm.
electric assist, so you can go for longer distances. So you just have to be able to tell yourself, all right, I'm feeling it, I'm feeling my quads working a little too much, I need to start stopping or head back home, that kind of thing. As long as you have that self-control, that's probably the best word. Because some
Right.
people don't.
Right.
Like I'm one of those. I go to the gym and I want to hit certain. I'm competitive, so I want to hit certain weights and certain reps and all that. And I have to tell myself, put on the blinders, don't look at the other guy lifting the weights, don't start comparing, just do your thing, get yourself tired. I've gotten I've gotten good at that, but there's times where I'm like, well, I'm going to put on an extra 5 pounds so I can meet that person, or I'm going to run a little bit faster because even though I'm getting a little bit older, whatever, I want to keep up with them. Or I see somebody older than me running, I want to run as fast as them. But anyways, you have to have that self control to tell yourself to stop. But if you have the confidence that you can use your glutes on the bike, then I'd say go for it. Some people,
Okay.
especially if you've been biking in the past and it's clicked for you, like you
Mhm.
figured out how to use your glutes on the downstroke. It's something that's important for everybody that, in case you're hearing me talking about bikes for the first time, when you pedal and you're pushing down on a bike pedal, that leg that you're pushing down with, the glute, the butt muscle on that side, say it's your right foot pushing down, your right glute should tighten up a bit. And you usually do need to consciously activate it. And then as you bring the left foot down, the left glute needs to activate, and you have to consciously be tightening your glutes, alternating as you're cycling the whole time. If you can accomplish that and finish your bike ride and say, whew, I feel it in my glutes more than anywhere else. You're going to feel it in your quads too, by the way. Just want to make sure
Mhm.
that we're clear on that. But if you feel it more in your glutes consistently, then Joe, I think you're just fine.
Okay, and the other thing I just want to emphasize too is this has a throttle. This bike has a range of 75 miles and it goes up to 28 miles an hour with no
So cool.
pedaling, just with the
Oh,
throttle. So
wow.
I was going to use the throttle to just,
Yeah.
if I had problems with, hey, you know what, I'm having trouble activating my glutes today,
Oh,
or I'm feeling
yeah.
something here and there, I can just throttle my way through. No, it's
Very
not
nice.
exercise. But the bottom line is I'm not
Yeah.
using this so much
Yeah.
for exercise. I'm using this
Yeah.
mostly just to get out and do things. And by the way, practice my
Right.
glutes on the bike, which I want to
Yeah.
transition to in the phase 4 anyway. So it's a
Yeah. I
win-win.
think you're fine to do that. Yep. And
Okay.
just understand, like it happens all the time. People, when you're in this transition where you're trying to get back into that activity that you enjoy doing that has potential to harm you, if you're not careful, it's okay to overdo it at times, or like know where test your limits. That's what I want to say. It's okay to test your limit here and there. Just know that you know what you're doing. You know that you know the aggravating activity, and then you'll know how to handle it the next time. So I'm confident, having gone through our program, that you'll be able to peel it back as needed.
And that's the nice thing about the program. You get to learn so much. First of all, you become an expert in yourself, in your back, your condition. I mean, you get a PhD, if you will, in just learning this stuff. And then, after being in the program so long, what the co-contraction is and what the muscles are that you want to stay away from, and you just don't want to go back ever. So that's all part of it as well.
Oh, that's so cool. I'm glad. Well, any final words you want to leave people with, people that are thinking of joining our programs, especially like the hip arthritis recovery program or the knee arthritis recovery program, which, Joe, it's the same muscle imbalance that causes back pain. Because there's people that are watching right now that are saying, wow, I don't know, I'll just see what I can do on my own. Especially coming from an ER doctor, somebody who's been through medical school and has had a surgery that possibly could have been avoided, what would you say to them?
It's funny because there's a hope factor here. As a physician, you would think, okay, this should be easy for me. I should get to the right people. I should get the right exercises. The physical therapists are going to know what to do for me. The doctor's going to know what to do for me. I thought about folks that have absolutely no medical background that experience this kind of pain. One person mentioned a few minutes ago how intense pain can be, and nobody believes them. My goodness, it can be intense. It's incredible. And going through that and just wandering in the wilderness without having absolutely how do people do it with no background at all in medicine? I had access to physicians that I dealt with over the years who were orthopedic physicians, neurosurgeons. I didn't have much access to physical therapists, but when I got dumped into the physical therapy realm, they're good people. They try to get you back to where you need to be, but they absolutely are doing nothing in terms of helping with the muscle imbalance that you're experiencing. So the good news is that you can avoid surgery. I wish I would have not had the surgery, right, but there is hope. You can avoid surgery, but it requires some work. I did the surgery thinking I was going to be done. Bam, I was going to be done. It was going to be all done. And I was going to be done. Nope. If I were to go on again without finding this, I think I would have nothing fixed my muscle imbalance. Bottom line, the surgery did not fix my muscle imbalance. That's the point. So there is hope, and even a physician like me that got lost in the wilderness. Please know there is hope, especially if you can follow the program and follow the exercises. But it's not easy. It takes work, but it's rewarding once you're not in pain.
Well, thank you so much, Joe. Awesome words of wisdom coming from a guy who's been in our program for a while, who's had some improvements and who's got a little bit of a medical background as well. Thank you for your time, Joe. I appreciate you so much.
My pleasure. Thank you.
Yep, absolutely. Oh, Dr. Lyons says, thank you so much, Joe. It was really illuminating. Oh, well, guys, before we move on to the next thing, I just want to let you guys know about our program, a couple more details. Are you going to show yeah, cool. So you can start phase 1 of the hip arthritis recovery program completely free. If you just go to the website, our main website, and you'll see this page. You can see it on the phone right there. And you hit the play button right there. The videos are there. You don't need to log in. You don't need to set up an account. You don't need to pay anything. You just go to that website and you can start phase 1 of the program to see if it's right for you, to see if it helps you, so you can get an idea of how this all works. And then if it's right for you, you'll see buttons on there to apply for membership and take the next steps and all that. So my hope for you guys is just to get knowledge, to learn this stuff so that you can begin to help yourself. Like Joe said, there's some work involved. But this is how anything worth doing is done, right? You have to do some work on your end, but the payoff is enormous when you can avoid surgery and thrive in life because you're feeling fantastic. All right, guys, let's get to the lesson. Finally, what you're here for, right? I hope you got some value out of that. And Sir Joe's a wealth of information. And by the way, if you do end up joining, before I forget, if you do end up joining our hip arthritis recovery program, you'll see Joe in the program. He's on our weekly group coaching calls. He is probably one of the most studious guys there, ready with his glasses, taking notes, has tons of questions. Not always in the group, but I know he's like, you saw, he's talking to the people. He's utilizing the resources definitely. He's on the private community as well, and he's asking questions in there. And that's why he's making the progress he's making, because he's just he's involved. And I'm sure he'll be happy to chat with you if you join the program and start asking him some questions in there. All right, guys, let's get to the top 5 reasons why age does not cause hip arthritis. This is a huge thing, because everybody in the medical field just says, oh, arthritis comes on as you get older. It's just an inevitability. It's going to happen no matter what. You're in your 60s now, even you're in your 40s now, or your 50s, arthritis just starts to show up automatically because you're older. This is the thinking that people in the medical field have, and they communicate it subconsciously, maybe consciously, to their patients. And so the patients, you guys are saying that now. You're like, well, they said I'm 60 now, so they took an x-ray. That's why my knee hurts, because I have hip arthritis, knee arthritis, or hip arthritis, if it was your hip. So let's talk about number 1 here. Number 1 reason, let me make sure I get my words right. It's a mistaken connection. Let me elaborate on this a bit more. Another way to put this is it's a mistaken correlation. In other words, people just think that as you get older, you get worse arthritis. But what you need to think about, think deeply about this. How did your life change as you got older? As far as the activities that you do, because we're talking about hip joints here. It's a big joint in your body that moves all the time as long as you're moving. But what happens very often is, as people get older, they sometimes become less active. They're sitting a bit more. Maybe you retired and you're not working, and so you don't get out as much as you did. Some of you guys retire and you're busier than ever. I have relatives that are like that. They're like, I'm always doing stuff. I'm always out. I'm exercising more. And good for you if that's your case. But some people, I happen to see it a lot in our hip arthritis patients, they end up slowing down, not necessarily because they're in pain. Sometimes it is, but they end up slowing down in their activity. They're just, the kids are out of the house. They're all grown. You finally get to those shows or those movies you want to watch, or that book you wanted to read, or you finally get to that hobby that requires you to sit. Maybe you still work and you're at a desk job, and that decreased activity is actually what is that's the big factor in leading to your arthritis, not your age. It just happens that time is passing, you're older. And so people make that mistaken connection, that mistaken correlation. But what we see is that when you exercise, especially the right way, and the research is showing that any exercise improves arthritis. But what I'm saying, which isn't proven in the research yet because we haven't studied it, the research studies out there are not great. They're very minimal. They tout that there's a lot of research, but we need a lot more. Specific exercise, the ones that we talk about, really cures the root problem, but they're even showing that just general exercise improves arthritis. So there's something to that. Movement is a big deal. And if you find that you're moving less these days, that's probably the main reason why you have progressed faster in arthritis. So it's a mistaken connection. They think that it's just age, but it's probably more activity level. I'll write that here in parentheses. Activity level. All right, let's get to number 2 here. Let me use a different marker. This one's kind of giving out. We burn through markers here. We're always whiteboarding stuff. All right, so number 2 is pressure over time. This is where I'm going to explain to you the root muscle imbalance. This is key. This is the crux of what I'm talking about to you guys, the muscle imbalance. Let me come over to the skeleton to show you this, because if you can understand pressure over time and wrap your head around this is not hard to understand. Just you got to focus in for just a bit. This is what the doctors, the medical professionals, the physical therapists out there aren't connecting. And when they'll connect it if they pay attention. I show them this stuff all the time. But if you think about your hip joint, where people get hip arthritis, it's right here. There's the ball, there's the socket. When you have a muscle imbalance, it's usually the muscles on either side of the joint. Just to keep it simple, it's a little more complicated, but the most simple explanation, you have muscles on the front of the hip. Those would be your hip flexors. They come up to the spine and they come down. They attach to this part right here. They kind of wrap down this way. And then on the back of the hip, you have the glute muscles, the butt muscles. They start along the edges of this bone here onto the tailbone. They come out and they attach to the side of this bone. Those two muscles oppose each other. They kind of have opposite activities from each other, motions. And so if you are less active, usually the butt muscles on the back of the hip get weaker. They atrophy, they get smaller. And as a result of that, because they have a resting tension, a gentle pull that happens even when you're just doing nothing. Both muscles have that, but if they're weaker on the back, you have a lower resting tension. And so that means that the resting tension from the hip flexors in the front is going to overcome resting tension from the glute muscles in the back. So when you're doing nothing, the ball just starts to drift forward in the socket and increases the pressure right here where I'm putting my finger in between the bones. And that increased pressure over time, and as you begin to move now with this muscle imbalance, you apply excessive pressure through here, and that's what slowly over time develops the hip arthritis. Just think of it this way to give you a different explanation. If I have you put your hand out on a table and I apply some pressure on top of your hand, even if it's not immense pressure, just some pressure, you could take it for a little while, 5, 10 minutes, maybe 15 or 20. But after 30 minutes, an hour, a few hours, your hand's going to go numb. It's going to feel uncomfortable, and you're going to want to really get out from under my hand. And you will. You'll just move out. But if it's inside the joint and you have a muscle imbalance and medical professionals out there can't identify this in you, you have arthritis that just worsens over time because of the pressure buildup, because of the muscle imbalance. That root muscle imbalance is what is causing the issue. There you go. All right, so hopefully you understand that. Guys, if you have questions about that, I really want to make sure that I answer them. So comment, type in the chat what your questions are about this pressure over time, root muscle imbalance concept, because if you're watching me for the first time here, if you've seen a couple of videos and you haven't quite wrapped your head around it, this is critical. You need to know this stuff. This is what you won't get at other at the doctor's office from your physical therapist. It's rare that they'll know about this stuff. Usually it's because they've seen my information. And if you understand that, then you can unlock a lot of why your hip is bothering you. You can start to connect throughout your day what's causing the problem. All right, let me go to number 3 here. Just to say one more thing about this, sorry, just it's so important. They think that it's age that causes hip arthritis, but when you realize that pressure over time is what's really causing your hip arthritis, you all of a sudden change mentalities and you're like, it doesn't matter that I'm 70 or 80 years old. You can fix that pressure no matter your age. So number 3 here, again, no matter your age, your body wants to heal. I mean, think about this. If you're older, whatever your age is, 60s, 70s, 80s, and you get a cut on your skin somewhere, like you nick your hand. I scraped my hand the other day on I was hiking and I was playing with my kids, and I have a little scab here, if you can see it on my knuckle. My body's healing. And if your body heals too, your skin heals, then you have the ability to heal. There's extreme conditions out there. There's situations where people can't heal as well, like uncontrolled diabetes. If you have certain blood flow conditions, there's certain conditions out there, but you probably know about those conditions if you have them. But if you have recently cut yourself somehow and your body's scabbed over and you went through the normal process, sure, maybe it took a little bit longer because you're in your 80s now, but it still happened. You still healed. Your body has the capacity to heal. No matter your age, your body just wants to heal. It's moving in that direction. And so this idea that your joints just wear and tear and get worse over time in your hip, and that you get bone on bone in your hip, I think it's just false. There's something else at play. You can't just chalk it up to age. That doesn't give you any control over the situation. But if you realize that your body wants to heal and you give it the right environment to heal by fixing the pressures in the joint, then it's very possible to heal and alleviate pain in your hip and improve motion, as long as there isn't any massive structural problems, which is extreme situations. Most cases of hip arthritis can improve dramatically without surgery. So you need to make sure that you realize this. Body wants to heal. Let's answer some comments here. We got some questions coming in. So let's see what you guys have here. Cindy King says, this is what's puzzling to me. I have always been active. My job is standing most all day. It's killing me not to cycle this summer because I love it. Being an athlete in college, in school/college, worn body. Yeah, so depending on how you were active before, because like I've always been an active person. I've always done sports and I go crazy if I can't exercise. But before I figured this stuff out in my own body, I was getting issues too. And I think I see this happen to a lot of people where they've always walked or jogged or cycled or done some sport, racquetball, now it's pickleball, and you just dealt with the aches and pains. But now you know that you have a muscle imbalance potentially. And if you go exercise without changing the way that you exercise, if you go walk, run, play whatever you play without thinking about using the right muscles to address the root imbalance, then you're setting yourself up to continue to injure yourself. So just make sure that you wrap your head around this pressure over time, muscle imbalance concept, because that's what allowed you to get back. Joe was asking about using the bike. The reason why he's asking that question is because I often tell people, stop cycling. I'll say stop walking even. Some people get all riled up when I say you shouldn't be walking. And I'm not saying never, ever do that. I'm not saying never get back to cycling, never get back to sports. But you need to put your body in the right environment to heal by fixing the imbalance, then get back to that activity, then get back to walking or cycling. Joe had to figure out how to use his glutes, how to use his abs, and get confident at using them so that he can say, all right, now I'm going to go on a 20, 30, maybe hour-long bike ride or longer, having confidence that I'll use the right muscles. And that's what you have to get to. It's not just a straightforward like, okay, now you got a little bit better, go back to sports as you were before. That's asking for problems. Hope that helps you, Cindy. AG says structural problems such as, oh, good question. So when I say structural problems, I'm talking about deformities in the ball and socket joint that limits your motion. And let me explain that, because as soon as I say deformities, people are going to say, oh, I have bone spurs, I have sclerosis, I have my x-ray report says all these words that are deformities. The way that you know the deformity, you all are going to have them. It just happens. Nobody's joint is perfect, but the way that you know that they're too far gone is when your motion is severely limited, and it's been limited for a long time. And by a long time, it's usually a few months, like 3 months or more. So let me just show you what I mean. This is something that we do, by the way. We're doing safety screenings on everybody who joins, who's looking to join our programs, or even try out like phase 1 of our programs. And you can contact us if you want to do a safety screening with us. It takes 5 minutes. But one of the motions that we'll check for hip arthritis specifically is how well you can bring your knee to your chest, because this motion is so critical. I mean, you bend over and you're bringing your knee towards your chest here. To get up here, you'll need to put your socks and shoes on, pants, anything that where you need to bring your foot up to your hands. It requires you to bend your hip a lot. But if the ball and socket joint are so bumpy, lumpy, misshapen because of hip arthritis that you can no longer bring your hip joint up because those lumps are kind of stopping each other from moving well, that's the structural deformity that I'm talking about. And it's when it's been like that for a long time, because it's possible for your muscle imbalance to shift the ball within the socket and temporarily impede the motion, not let the motion happen the way that it should. So you might feel like you have a restriction, but it just happened a week ago, a few days ago. If you do the right things, you could probably get the ball to settle in the socket better and improve the motion. So it's a salvageable situation. A lot of people are like that. But if it's been 3 months or more that you cannot bring your knee up very high, then you likely have a structural problem that probably will benefit from a hip replacement. But if it hasn't been that long, it's been a few weeks, a month, maybe 2 months, you potentially have room for improvement and you can fix your motion. And then the final thing that I'll say about this is, if you have one hip that's involved, let's say it's my right, and you can pull your knee towards your chest, let's say this is 100% of your motion. Everybody's a little bit different. Some people have always been able to come up pretty high, some can't, and that's just their normal. You can't come up as high. As long as the other one comes within about 80% or better of what your good hip does, then I think that's a pretty good sign that you're going to make some improvements going through our program. So that's what we're using, just as the criteria. Good question, AG, on the structural problems. NS, that's a long one. I'll say V because that's what your picture says here. What about having one hip hurting down the side of the thigh, but as soon as I start moving around, it's gone? But also have hip flexor pain and piriformis, which the latter hurts with more exercise. So what then? This is an interesting situation. So when you have pain down the side of your leg, and then you start moving around, what that's usually an indication of is that your pain is coming from your spine, from your lower back. And when you begin to move around, you probably activate the right muscles to make your spine settle appropriately. You get stability in your spine and take some pressure off the nerve that's sending the pain down your leg. And then if your hip flexors and piriformis are also hurting, that's usually connected to the muscle imbalances that are causing those problems, because your hip flexors specifically, let me show you on the skeleton here. The biggest hip flexor muscle, well, one of the bigger ones is the psoas muscle. The psoas runs from these bones here in your spine down all the way to this bone in your thigh, upper thigh area. And if that muscle's over dominant, as happens with hip arthritis problems, it will compress the spine here, and it can put pressure on these little nerves, and some of these nerves end up innervating the outside of your leg, so you can get pain on the outside of your leg. It's one of the main reasons why people get pain out there. And then you might feel tightness or discomfort in the hip flexor muscles themselves as well. So this sounds like you have the muscle imbalance. It's just affecting you differently than other people. You might be getting some sciatica symptoms as well. This is what Joe was talking about, is exactly the same issues, similar issues that are affecting Joe. Joe, I don't know what age you are, V, here, but Joe's situation, he had surgery. He was getting pain, the sciatica type pain in the buttock. That's where he even thought he had piriformis syndrome. That's what the doctor told him. It is so common to get that buttock pain, and it's not even the hip joint itself that's causing the problem. You might have hip arthritis though on the x-ray, but it's the muscle imbalance. And this is why I get so worked up about this, because in the medical field, we try to nail it down because they're using imaging. They're saying, well, I see this problem on the x-ray. I see this problem on the MRI. But the muscle imbalance is what connects everything together. And if we begin to address the muscle imbalance, all the things improve most of the time. So I hope you can check out your glutes and see if you need some work there. Maybe your lower abs too. Good question. Julie Parker says, would the muscle imbalance also cause facet joint irritation in the back? Oh yeah, Julie, absolutely. The piriformis. So it's not just the psoas muscle, the one that I said connects to the lower back. But another muscle imbalance that happens along with this one for the hips is your lower back muscles on the back of your spine. Let me come back over here. So when you have over-dominant hip flexors, that psoas muscle that connects from the vertebrae here down here, that muscle can compensate for weak lower abdominals. It very often does. And when you have weak lower abdominals, because those abdominals give stability to your hip bones here in your back, if they're not doing their job, then you'll get compensation from the back muscles. And because the back muscles of the erector, the spinal erector muscles, are right up against the facet joints right here, when those muscles work, they compress the joints. They add pressure, and over time, you can get facet arthritis and facet impingement and nerve impingement as well. So now you might have a combination of both the psoas on the front side of the spine and the back erectors on the back side of the spine, both overworking because of weak lower abdominal muscles, those low abs, and weak glutes. And when you get stronger in those lower abs and stronger in the glutes, you can calm down those hip flexors and calm down the back muscles and take pressure off your spinal, your facet joints. Hope that helps you, Julie. Got a two-part question from Dr. Lyons. Based on this curriculum, I have progressed to phase 2. It will take a while to move to phase 3, I can tell, but at least I'm no longer stuck in phase 1. Fantastic, Dr. Lyons. When can I determine that my glutes and abs are ready? I am going to get back on my too expensive elliptical and rowing machines. Yeah. When I can determine. Oh, I see. It wasn't a question. She was just telling me when I can determine that my glutes and abs are ready. I'm going to get back. Yeah, I think that's fine. And just, I thought you were asking, but just for those of you that might be wondering, like, when do you determine that your glutes and abs are ready? In our program, we go based off of when you meet the criteria. So it's not just a feeling. Some people operate that way, and they make their way through the program without really paying attention to the criteria. Both people that are in our program and people that aren't in our program and watching our videos, like this video right now, because I'm showing the chart and you can see this, and you guys screenshot it and all, that's fine. It's on our website for free anyway. But my main concern is that you're only doing exercises from the right phase. So if you're in phase 1, if you qualify for phase 1, don't be doing complicated exercises. You're going to hurt yourself. In your case, Dr. Lyons, you need to have that trust that you're ready for the right exercises. And like with Joe, he was getting back to cycling. You want to get back to using your elliptical and rower machine. You have to have that confidence that your glutes and your abs are going to tolerate the exercise, and you don't begin to compensate with other muscles that could hurt you. I was on the rower the other day. I love using the rower, but I'm tall. I'm 6'2", and I'm more torso than legs. And so for my body type, when I use the rower, I use my back muscles right away too much. I can tolerate probably about 10 minutes, but I'm really struggling to use my abs and my glutes. But other people this is what I find, people that have more legs than spine, they love the rower and they tend to tolerate it pretty well. So you just have to figure out what works best for you. I tolerate running really well, and I love to do it. She says, I will only be doing exercises in phase 2. Perfect. I think that's where you got to be. And then eventually you start to test the limits and see if you can get into the next phase. Fantastic, Dr. Lyons. Donna says, I love the fact that you say it's not age. That is what my brain says. It's true. And sure, you feel yourself aging in other respects. You know, you see the gray hairs and the wrinkles and all that stuff. And people around you, are younger than you now. And you run into all that stuff. But I see consistently these things here that people are just they're mistaking they're not realizing that their reduced activity is associated with their pain, and they're not understanding the pressure over time principles, and they don't even regard that the body wants to heal. They just say, oh, it's wear and tear over the years, but no, it's fixable. We see people do it all the time in our programs. So glad you're here with us, Donna, part of the community. AG says, what if you have one hip lower than the other and rotated? Yeah, that happens. So what AG is talking about, let me show you on this. This isn't something that we fix in our programs directly, but indirectly we do. So it's possible for your pelvis bones here, this would be your hips, to be rotated this way or shifted inwards or outwards. Here in the clinic, if you were ever able to come into our clinic, we will, myself or our therapist here, can shift your bones manually with our hands. That's why we say El Paso manual physical therapy, because that's kind of our background. However, it doesn't last unless you fix the muscle imbalances, which means that if you only fix the muscle imbalances and never get the hands-on work, you'll still fix it anyway. So it's not 100% necessary for you to come into our clinic and get hands-on work in order to settle this. There's extreme situations where we do talk to people, and we'll recommend go see somebody in person who knows what they're doing with their hands and can adjust this or manipulate this for you. Maybe come here if it's right for you. But either way, you need to fix that imbalance, because it's the muscle imbalances that are allowing these bones to shift and move out of the way. If your abs are weak, you lose stability in these bones. If your glutes are weak, these bones don't have stability. If you have good strength in both abs, lower abs that connect to the edges of this bone, and the glutes on the back, then you have tension in the right ways that holds these bones in place and pulls them back into the right position if they're shifted. So the long-term fix for these shifted hip bones, one leg higher than the other, one leg longer than the other, is fixing the muscle imbalances. Now, sure, there's genetic anomalies where you have one leg longer than the other, and that's your bone structure. I'm not claiming we can fix that. But the functional shifts, the ones that happen because of your muscle imbalances, absolutely those will improve. We see that happen all the time. Good question, AG. Hey guys, we have our helpline available right now. We're going to show you the number here. It's right there, 915-200-4159. If you are stuck on an exercise, on some concept, if you have a question for me, I want to get you unstuck, whether it's hip arthritis related, knee arthritis related, back pain, I'd love to help you out. So call us right now, 915-200-4159, and I'd love to help you out. Fantastic. All right. EB says, just tuned in. I just have been told I have arthritis in my right hip and need it replaced. Do I have to have surgery? Thank you, Eric. It depends on the severity of your situation, Eric. It really does. But number one thing that I would look at, I love this question, because you get told, everybody gets told they have to get it replaced as soon as the arthritis is severe enough. As soon as it's like stage 2 or stage 3, according to their staging system, they say, oh, a hip replacement might be beneficial for you. But what I would look at, Eric, is can you bring your knee to your chest, even if it hurts? Do you have decent motion in that direction? If you feel like you can still get around, if your muscles still work pretty well, if you feel like you can be on your feet at least for a few minutes at a time, then there's excellent potential in you improving. Now, you might have immense pain, especially if you stand too long, or if you take your hip to end ranges of motion, you might feel some pain there. But if the joint moves a decent amount of motion, 80% compared to the other side or better, a lot of people have 100% motion on both sides, and they get told they have hip arthritis and have to have a surgery, that it's bone on bone and that they need a joint replacement surgery, even though your motion's fine. I have beef with that, because if your motion is good, that joint works. It's a functioning joint. It's just irritated right now. And the surgeon, they're trained to tell you, if we see signs of arthritis on your x-ray, they point at your x-ray on your hip, and then they connect that with how bad do you want the surgery? How desperate are you for relief? And if they can make those two connections, they'll say, all right, let's schedule you for surgery. But if your motion, they don't always consider motion. If your motion's really good, even though you have really bad x-rays, you might not even have that bad of an x-ray, then what I would say is you need to go through our program. You start going through the phases of our program, and you're probably going to get a big improvement. That's not for everybody. Some people aren't willing to put in the work. Some people are okay with having surgery, even though it doesn't fix the root problem. That's your decision to make, obviously. So you got to figure that out, Eric. Good question. Debbie on Facebook says, I can't join your program at this point. Are there any videos online that can get me going in the right direction? My right hip is a problem, and now my right knee as well. Thank you kindly. Oh my gosh, Debbie, we have so much. First off, go to we have on our website, phase 1 of both the hip and the knee arthritis recovery programs, 100% available. You don't have to log in. You don't need an account. They're on the page. Go to the website right there. My staff's showing it for you guys, and you'll see where to click, and you can go onto the page where you can start for free. We have that. And then we have tons of videos here on YouTube. We have entire playlists. We'll see if somebody can comment our playlist on here. But you can go onto YouTube and go to our page and hit playlists, and you'll see several playlists that we have there. We have one for knee arthritis help and hip arthritis help. I'd start going through that. Those are all available for free on YouTube as well. So go check that out. Awesome. Who else has got a question here? BMF says, can your hip joint really rotate and cause you to get knock knees? Can it be fixed, and will it revert? Well, there's different reasons for knock knees. I like this question. Knock knees, just so that we're all on the same page here. Knock knees is when, if you look at my knees, the knees come inwards. And so when your knees come inwards like this, go ahead and tip it down just a bit more. When your knees are coming inwards like this would be knock knees. I'm being extreme, obviously. But see how I can make my knees look knocked? But I'm doing this from my hips and my feet. When my arches collapse and my glutes aren't working right, and I'm using more quad and inner thigh muscles, I can bring my knees together. And see, when you use your quads and inner thigh muscles too much and you don't use the glutes back here enough, that's what tends to happen. And you can correct this by getting better glute strength. If you can activate your glutes and you can put your knees in the right alignment. Now that's what I would call a functional movement, a functional knock knees. But there's structural knock knees where the bones actually change shape. And this happens in some people that have arthritis. I think some people are just susceptible to getting this. That I don't know that we can correct 100%. I've talked about it here and there, but using an unloader brace. This is a specific knee brace called an unloader brace. I did a video on it a while back, maybe a month or two ago, that is shoving your knee outwards if you have knock knees. If you have bow legs, like a knee that goes outwards, you can also use a similar brace, an unloader brace, to push your knee inwards. The braces can move them in both directions. We don't have any solid research on this. I don't even have any case studies. It's just my expert opinion that I think you can do this, because there's I've extrapolated this from other things, like people get braces to adjust their teeth, to get their teeth aligned. There's stories of like Chinese foot binding. If you look at that, I forgot the group near Thailand that extends their neck bones using rings. There's all kinds of body adaptation things that people do using bracing of some sort. So it stands to reason that if we use an unloader brace that is shoving your knee into a straighter position, I think you can improve. But I need you guys to try it out. I don't have the capacity to create a study like that. We need some case studies of people that have that problem. But at the very least, get stronger in your glutes, get stronger in your feet, and make sure that you fix the muscle imbalances. All right, we're gonna take a call from Melanie in South Carolina, who's got a hip issue. Let's see here. Hey, Melanie. Melanie, are you there? This is Dr. David.
Yes, thank you for taking my call.
Absolutely. Nice to meet you, Melanie. How can I help you?
I feel like I'm on a radio talk show with a celebrity. I'm a little nervous.
Oh, no problem. We'll just chit chat like we're pals.
Okay. I'm very new to this program. I'm all of 4 days in, Dr. Dave, but I tell you, I have been all on board. I've been following your recommendations with your time and your durations in stage 1. I've offloaded with a cane, I'm using my massager, and I do believe in using my exercises correctly. I had to make a few adjustments, but I do believe that I'm doing them correctly on the hour and following you to the T.
Wow.
And I was feeling good about things 4 days in. Day 5, I felt awful. My hip was killing me. I was starting to get shock waves up my hip. It was a bad hip day. And I began to have some knee pain. So I spoke with Amber, and by the way, she's been so kind to me and just really generous with her time. But she seemed to think that I needed to slow down. So I was like, well, what does that mean? Do I do half of what I'm doing? And that's my question for you. Because I really want to stay on board with the program. I had to stop. I'm happy to recommence and get on board, but I just feel like, what does slow down mean and what should I do?
Yeah, great question, Melanie. I love this. So it sounds like you're the type that's a go-getter. You're going to go 100%, 110% if you can. And that's good. Overall, that's good. But it is very possible to overdo it. And so the thinking that I want you to have, what I want you to start to begin to process is, you found your limit, your current limit. And that's going to increase as you get better. And so this happens all the time. This happens all the time in our program, especially with people that are your type, the ones that want to go 100%, 110%. Is you're doing the right things, but you just did a little too much of it. And my recommendations where I say things like do 10 reps every hour. I say this in the program all the time. But I also do say back off if you start to have some discomfort. And the ideal is if you feel discomfort in the moment, because then you know right away you have feedback that's like, okay, rep number 9 at the end of the day started to hurt me, then I need to back off the rest of the day. The trouble that maybe you ran into this is you didn't feel any discomfort until the next day, day 5.
I would say that was the case.
Yeah, that happens too. So that's how your body is receiving feedback. And what you need to know, what you need to think about is what did you do in the days leading up to day 5, and moving forward after you rest a bit, recover, make sure that you get over this flare up, is cut down what you did by 10, 20, 30%. You're going to have to use your best intuition, your best judgment to figure this out. But here's the best part, Melanie, is give it another week or two at 70% or whatever you determine is right for you. And then you'll be able to climb up out of there into 80%. You'll start getting improvements. This happens normally, and it's just a matter of you fine tuning and adjusting our program to your current level and ability.
Okay, that makes sense. So 10 to 30% back off.
Yeah, it might be 50 or 90%. I mean, it sounds like you did quite a bit, and so you'll probably be able to tolerate more than 10% of what you did. But what the main takeaway point is, you got to figure out what works for you right now.
Okay, and you're saying just pay attention to your body, and if I feel the next day that I'm having pain, and probably record what I'm doing so I can kind of look at the numbers and pay attention. Okay,
that would help. Yeah, we have people in our program all the time keep a little journal, and it doesn't have to be super complicated. You don't have to write paragraphs in there. Just write, the date and how you felt and what you did. That way you can look back and you don't have to hold it all in your head, and you can say, oh, I did 100 reps and then I felt not great the next day. Let me cut it down to 50 or 70 reps and see how I feel the next day.
All right, that sounds like a plan. I so appreciate it. And please know, Amber, as I said, was just really wonderful, and you're very lucky to have her.
Absolutely. Oh yeah, you're not the first to say that. Thank you so much, Melanie. Pleasure meeting you.
Thank you.
Yep.
You too. Have a good day.
Thank you. Bye-bye. Thank you, Melanie, for calling in, and such a good question. In our program, we have a lot of guidelines, a lot of recommendations for how to proceed, how many exercises and reps, and we get, as a result of the guidelines, like we don't have always hard numbers, like do this many reps, do this many sets, or use this. We have ranges and ideas as guidelines, and that's the point here. Is everybody's different. You've got to figure out where you're at. Your strength might be very different from somebody else's. You might be on extremes of strength. That doesn't mean you can't do the program. You both can do the program. You just have to figure out if you're very strong, if you're very, capable of doing this movement, this exercise, whatever it is, then maybe you can tolerate more right now. And if you're not capable, then maybe you can tolerate less, but you can still do some. And over time, you can work your way up. And that's how you move through the phases and get from phase 1 to 2, 3, and 4. And make the improvement. So I love this program, the way we've developed it, because it meets everybody's needs where they're at right now. Awesome. All right, let's get to number 4 here on our list. Let's go purple now. Oh, I love this one. This is one of the best ones that I've had in a long time. I got this from a mentor of mine. So going back to the top 5 reasons why age does not cause hip arthritis. Whenever I throw this one out, people are like, oh yeah, I didn't think about that. It's obvious, but you just don't think about it in the moment. But I mean, it's pretty clear that both hips are the same age, right? Whatever age you are right now, say you're 60 years old or 70 years old, your left hip is the same age as the right hip. So if you only have one hip that's bothering you, one hip that has hip arthritis, and the other one looks fine. Some people get it on both sides, but it often happens that people only have one hip affected or one way worse than the other. Then how does this work? How is it age related? Because if hip arthritis is truly age related, meaning at 60 you're going to be affected now, And at 61 and 62 and all the way to 70, you're just progressively getting worse. Wouldn't it affect both sides equally? What's going on here? There's something else at play. It is not just age. I don't think it's age at all, really. There's something about the way you move, the muscle imbalances, your symmetries and your asymmetries, how you're not symmetrical, that's affecting this. And sometimes it's about the way you sit, if you're more dominant with one leg versus the other, the activities that you do, the way you stand, the footwear that you have. There's all these little factors that pull in that contribute to why you're getting hip arthritis on just one side versus the other. So both hips are the same age, but you only have one side that's affected. That doesn't mean that it's age related. For me, that clears it up pretty fast. It is not an age related problem, but one affected. I love that one. That's just straight into the point.
You have Cindy here. She says.
Oh, Cindy says I have it in both. Let me talk to that. Yeah, so it's possible that you have the muscle imbalance going on both sides, and so both got affected. But there's a lot of people that only have it on one side. Same thing with knees. I mean, if you only have knee arthritis in one knee, you might get hip and knee arthritis at the same time. It's always worse in one spot first. It's rare that people say both hips are affected exactly the same. But even in the people that have both sides affected, like you, Cindy, when I look at you guys, like when I see you guys in person, I start testing the muscles, I see how you move, I see how you're walking. The muscle imbalances are blaring as the problem. I see that glutes aren't being used effectively while walking. I'll test the glutes and they can't hold up on the muscle tests that I put them on. Then I'll test hip flexors and I'll test quads, and those test strong. I'll check the joint movement and I'll see that it's actually pretty good. So there's improvements. There's possibilities for improvements. It comes back to the muscle imbalance just about every single time, even if both hips are affected. It's just that's how your body presented with it based on your activity, your lifestyles, all those things factored in. Good comment there from Cindy. All right, number 5. This is another one that I think is a solid, it puts a nail in the coffin, in my opinion. Like it puts us to rest. We have people in our program all the time that are getting better. People, I meant to write get better. I'll write improve. How about that? People improve in their hip arthritis, yet they're older. They aged. I mean, like, think of Joe earlier. He said he was in the program since October of last year. He's older now. Obviously, all of us are, but he's better. He aged, but he improved. He went the opposite direction in his function and pain. So how is that possible then, that if hip arthritis is age-related, if like everybody thinks, then it would stand to reason that you would get worse as you age. And that happens a lot. We see that. Your typical mainstream medicine, like this, I talk to doctors all the time and they'll say, yeah, I gave people the medicines, they came in for hip arthritis. I gave them the medications that are recommended. I gave them the injection because they got worse after they came in, and then they still got worse. I sent them to physical therapy. They got worse. Then they ended up having surgery. I sent them for surgery. And so their perspective is, as time went on and this person got older, they got worse. But what's missing is they never got treatment to fix the root problem, the imbalance. That doctor doesn't understand pressure over time. They put them through medications, injections, general physical therapy, which isn't designed to fix the root muscle imbalance. They don't have that training. They're great for post-operative cases. And then they went to surgery, and surgery doesn't fix the root problem. And then even after that, you have the people that are discontent with their surgeries, are having problems after their hip replacements, and they're worse often. I don't know about often, but they're worse sometimes. I'll say that word. So when we teach people in our program, the hip arthritis recovery program, how to fix that root muscle imbalance, consistently they improve. And that's because they get educated on pressure over time and how to go through all these. Because it's not that straightforward. Like Joe will tell you, it's work, it's effort, it's a lot of brain power to get your body to be coordinated properly, to use your glutes on a bike or on an elliptical, like somebody else had a comment on, or even just walking, going upstairs, getting up out of a chair, getting out of a car, making sure your muscles work right consistently in all those activities is effort. It's like learning to play a new instrument for some people. If you ever learned a new instrument, my kids are picking up piano right now, and it takes lots of reps, daily practice. And for the first months, you sound like you're playing hot cross buns the whole time and getting good at just the basic song. But it takes you a year to be able to play some decent songs where people are like, wow, you've been practicing, you sound really good. Same thing with this. Whoa, you can walk better, it doesn't hurt anymore. It's taking me a year. That's what happens often. So I love this, guys. So just to review here, number one is people have the mistaken connection or mistaken correlation that they're just getting older and they're forgetting that they've also potentially slowed down in activity. Number two is you have to understand the pressure over time problem, because that is why arthritis gets worse. It's arthritis getting worse over time because of the pressure, not because of age. Then your body wants to heal no matter what age you are, as long as you don't have any sort of a medical condition that would prevent you from healing, because that does happen, but it's rare. Generally, your body wants to heal. If you have signs of your body healing, like you cut yourself and it healed, your joints can heal. Your hips are the same age. And so if only one is affected, it doesn't make sense that hip arthritis is an age-related problem, because both hips are the same age. And then people improve over time when they're doing the right things, yet they're getting older. So many reasons why this is not an age-related problem, but that's the general thinking. So I hope this was helpful for you guys. Hope you guys got some benefit. What comments do you have that I need to answer? What questions do you have? I want to make sure to leave you guys fully understanding this problem. AG says, right, so if you have one side weaker than the other, like your left side is totally weaker than the other, what do you do? Do you do more exercises on that left side? Good question. I wouldn't. I would exercise both sides. This is what I've learned in going through our program with all the members over the years recently is I was at first, I changed my tune. At first I was telling people, yeah, go ahead and focus on that weaker side. Do more reps. And then we had some people that just worked out both sides, and I found that they tended to improve more, because a person that's working out just one side is missing out on improvements on the other side. And ultimately, when you're better, because they did improve. You can get better just strengthening one side only, and then eventually bringing in the other side. But if you just work on both sides, you're going to have improvements. Even if one side's stronger than the other, you're going to pass a threshold. Let's say it's right here where my eyes are at. You're going to pass the threshold where it doesn't hurt anymore, because you have enough strength to move appropriately. You're not pressurizing that joint too much. And even though you're in the healthy strength range, you're still going to have a difference. I have a difference. My left glute doesn't work as good as my right glute, but my left glute's strong enough to not cause me any problems. I'll be running, I'll be lifting weights, I'll be just moving, walking throughout the day, and I feel like my left side is just lazier than my right. It happens all the time. It's never going to be perfect. And that's where I think some people that were focusing on one side got caught up, as they were trying to make them equal. And it's just not a reality. It's not going to be perfect. Just get them both stronger. Hope that helps you, AG. Debbie says, can I work on knee and hip arthritis simultaneously? Oh my gosh, absolutely yes. So the hip and knee arthritis programs are really similar as far as the curriculum goes, because it's the same muscle imbalance, Debbie, that affects both. So if you have both conditions, if you have both hip and knee arthritis, and if you're looking at doing our program, what we always tell people is join the program for the joint that's worse. In other words, if your hips are worse, join the hip arthritis program. If your knees are worse, look to do the knee arthritis recovery program. but you will benefit from either one. And we have people in our knee arthritis program who also have hip arthritis, and they're improving because it's the same muscle imbalances, very similar exercises that you're doing. And vice versa, we have people in our hip arthritis program that also have knee arthritis, but their main thing is hip arthritis. And if you can't decide, then I'd go with whichever one's worse today. I think you're not going to go wrong. And then just so that you know too, because it's likely that it'll happen to you, you might have a back problem like Joe. You might have sciatica. If you have more back pain issues, then you might do the hip arthritis program, just because that program's a little more tailored for back problems. But the knee arthritis program will absolutely help back pain too, all kinds of back pain problems. So you can definitely fix both. And this is different than what most healthcare practitioners out there will say. They'll say, well, you have a knee problem, there's knee exercises. And if you have a hip problem, there's hip exercises. They split it. And they don't understand the pressure over time and the muscle imbalances. And so that's why you get knee exercises and hip exercises, and one might hurt the other. But the way that we take this approach, it's a global approach. We're looking at all the joints and how they all work together and all the muscles, the chain of muscles. That's why we can identify the imbalances. That's how we can connect the two and fix them all at the same time. Good question, Debbie. Diane says, I had a torn meniscus 2 years ago, and it was bothersome, and I couldn't really exercise or walk far. I followed your advice about strengthening glutes, and now I can exercise at the gym and walk fine. That's awesome, Diane. I'm 68 too. Wow. When I originally had PT, they were all about strengthening the quads, and I got worse, not better. Orthopedic guy said to come back when it hurts enough to get a knee replacement. Thanks for your sound advice. You're welcome, Diane. That's so awesome. So glad you got better. I'm glad that you found what you needed and what worked for you. Sometimes PT does work for people, but some people know that it obviously is hurting them, like Diane in this case. And glad you're not having to visit that orthopedic guy again for the knee replacement. That's what they'll tell you. They'll say, well, you got diagnosed with hip arthritis or knee arthritis in your case, and just come back when it hurts enough, when the pain's bad enough. So happy to hear that you're better. All right, next one's 2 parts. We got JB, who says, I've shared your channel and videos to many friends and acquaintances. I cannot recommend you enough. Oh, thank you so much. My range of motion was very limited for a long time, and the replacement was long overdue. I am wondering, though, do you ever recommend the posterior surgical approach? And if so, when? I ended up having the anterior approach. I am very happy so far. That's not something I'm an expert on, JB. As far as like which surgical procedure to use, I've seen different results. There's advantages and disadvantages to both. From what I understand, more people are getting the anterior approach depending on the doctor that you're seeing. It's becoming more popular is what I'm saying. But some doctors prefer to do the posterior approach. I think you can recover from both pretty well. It just depends on what muscles you're recovering with afterwards. If you're using your glutes and you had a posterior approach, it's going to take you some time because they cut through the glutes. The anterior approach, they don't cut through the glutes, so it's a little bit different. It preserves the glutes a little bit better. But I've seen some people that get the posterior approach where they cut your glutes and they do great afterwards in the rehab. So it just depends. I would ask the surgeon. And something that you should know in case you do need a hip replacement surgery is some docs just prefer some surgeries because that's what they're good at, and they're just not confident in doing the other one. And if you're looking to get a certain approach, you have to find the doctor that does that approach. Like you have to Google it and do some research and find the right one. So hopefully that helps you, JB, and anyone else that does absolutely need a surgery. Is that Michelle? Yeah, Michelle says, which would you say is the most effective exercise for glutes? The one that makes the muscle burn. That's the most effective one. I know that's a kind of a smart aleck response here, but it's true. And I say that honestly because a glute exercise for me right now that makes mine work is heavy deadlifts with like 10 to 20 reps. But for somebody who's dealing with a lot of pain right now in their hip, they might just get a good glute workout by just standing and tightening their butt, or sitting and tightening their butt and holding it for 10 seconds. Those are kind of extremes. If you're in the middle, you might be doing a bridge exercise or a mini squat exercise. We talk about these here on the channel and in our program. The one that makes your butt muscles burn, work fatigue, whatever works for you, whatever term makes it click in your head, that's the right glute exercise to be doing right now. And you got to figure out the reps too, by the way. AG here says, I have got appointments to do keyhole surgery. I am getting better by doing your exercises and correspond the movement to what you suggest me. I've got an appointment. Okay, so you got a surgery appointment, but you're getting better by doing our exercises and correspond the appointment to what you suggest me. Okay, I'm thinking that you're saying that you're getting better with the exercises. So I don't know about your appointment. I don't know if you need to go. If you feel like you can delay it, postpone it, great, if that's possible. I know sometimes there's long waits for these surgeries, but if you're getting improvements, this is what I always tell people, especially if you're just trying like our free phase 1, if you're seeing improvements there, then the potential for you to get even more improvements going through the rest of the program is excellent. So I would take that as a good sign. And some of those exercises that we offer in phase 1 for free, I talk about on these videos. So if you're having any improvement with any of the stuff that we're offering, I think it would be fine for you to postpone or maybe even cancel the surgery and look to get it another time. But you have to weigh that yourself. If that's right for you. I don't want to tell you to cancel it for sure. You need to make that decision on your own. See if it's right for you. CB says, I'm having a pelvic floor exam today to see if it's contributing to my hip and lower back pain. Well, good. I'm glad you're getting that done to hopefully rule it in or rule it out. If you can rule it in other words, it is a pelvic floor issue, then hopefully that'll give you a lot of relief for your hip and lower back pain. That can be a contributing factor. But it could also be a direct hip or back issue that could be causing a pelvic floor problem. I've seen that happen a lot of times too. So hopefully you get some clarity on that, CB. Julie Parker says, does cold weather make inflammation more painful? I can't speak from experience myself. I have not had that happen, but I've seen a lot of people. I've talked to a lot of people that say that cold weather does make their joints hurt more. I don't know about inflammation specifically. I've heard people say that warm weather hurts them too. I think there's something to do with the barometric pressure. And there are pressure sensors in joints. And so if it stands to reason that if you have an irritated joint, those pressure sensors or nerve endings might not be reading pressure properly because they're irritated. They're not responding normally, and they might be very sensitive, even so sensitive that they can change. They can feel the pressure, the barometric pressure outside, and that can change with cold weather, or rainy weather, or warm weather. It just depends on how you interpret it, and like how your body interprets it. Good question there. Elaine Bellows says, what good for walking and knee exercises and for my hip, try and walk with bone and on bone knees works some all the time. So what exercises are good for walking for your hip and bone on bone knee? Okay, so you need to figure out how to turn on your glutes. I think what you're asking here is what exercises will help you walk better and make your hips and knees feel better. You need to make sure that you're activating your glutes while walking. And if you cannot activate your glutes while walking, then don't walk, because you're only going to use the wrong muscles, your quads probably, and make your hips and knees worse. So don't walk until you figure out how to get your glutes working. Of course, you got to walk some. You have to walk within your home. You have to take care of yourself. Go to the kitchen, feed yourself, bathroom, showers, all that stuff. So some walking needs to happen, but I would avoid walking any more than that. If you have access to those electric scooters at the store, use them. Get on crutches, offload, walk, use the walk or the rollator, use a cane. If you have to figure out how to offload yourself so that you're not irritating your joint constantly. And then while you're offloading yourself, hopefully feeling better, be using your glutes. Do that, the glute activation exercises. We have them all in the program, on the videos here. We have them for free available to you guys. As you can get those glutes to activate better while walking, then that's what you need to do long term. We have people that go through our program that never get to weightlifting. They never get to phase 4. They never get to the intense stuff, but they do figure out how to get their glutes to work while walking, and they do it very well. And they get immense success. There's a lot of people that just stop there. Like they don't really progress to the rest of the program because that's what they wanted to do, is just be able to walk more. And if you can figure out how to glute walk, that's, for a lot of people, 90, 95, maybe even 99% of what they wanted to achieve. And so you'll be fine with that, Elaine, even if you're bone on bone. We did a study in our programs, and we found that slightly more than half the people in both our hip and our knee arthritis recovery programs, they were told that they were bone on bone in their hip or their knee joint. So this works for bone on bone joints. Good question there. Let me get a swig of water while we look through some more comments here. And if you guys have a burning question, now's the time to ask. JB says, if when I go to the facility therapy, they do things that I feel aren't great, how do I handle it? Thanks again. That's a tough one, JB. I got this comment not so long ago too, and what I said, let me remember clearly. Two approaches. One is don't do the things that hurt and just let them know. You don't have to be forward or I wouldn't correct them necessarily. It depends on what kind of personality you have, I think. This is if you don't want to ruffle any feathers, this is what you should do. Is when you do that exercise that potentially hurts you or you think is going to hurt you, just tell them, just say, this one hurts me. Can I do something else? And then if you offer an exercise, maybe like, can I do something for the glutes? They'll probably give it to you and then say, great, this one makes me feel better. And just give them feedback that way. You're guiding them by telling them, I need to do this. And if they keep pushing quad exercises on you, just keep telling them that this hurts, but I like that glute one. Can I do that? That would be the way to not ruffle feathers. I highly recommend that. If you're the type that you want to ruffle feathers and you feel like you have rapport with your medical professional, especially like a physical therapist, what I would recommend is sharing this information with them. Like find a video or maybe share this exact video with them and just let them know, hey, this is where I'm getting my information. I'm not just telling you that I think quad exercises are silly and dumb and painful. Like there's actual reasoning behind this and there's somebody talking about it. I would share information with them first so they can get educated on it. Then have a conversation with them, and please don't be confrontational. That's my strong advice. Those of you guys that are confrontational, you're probably gonna do it anyway, but I would rather you go about this in a way that educates them rather than inflames them. We do get stories though here and there of people that didn't have a good experience telling their medical professional they didn't want to do quad exercises. NS says, what about the sciatica as that nerve can cause so much pain right down the leg to the foot? Is that still a hip issue? Very often it is. Yeah, it is, because so there's the sciatic nerve. Let me come to my skeleton. This is going to be helpful for you. The sciatic nerve technically starts right here when it exits this bone, right where my finger's poking out right there. But that same nerve, it's a bundle of nerves, and it runs down the back of the leg and it branches down into different areas into the foot. That same nerve is made up of a bunch of these nerves. So if we didn't think about the names and the divisions and we just thought about the pathway of the nerve, it starts here, runs through the front side, kind of under here, pops out the back, goes down the back of the leg, branches in different directions here, goes all the way down to the toes. Anywhere along that nerve pathway, if there's an issue that's causing compression or excessive tension on the nerve, it will become irritated. Now, the first thought is to think, well, there's a disc issue or some stenosis problem, some pinched nerve up in the lower back, and that's a possibility. But you can also get some pinched nerve in this area, in the glutes. You can have a hip problem. You can have an issue in the knee, in the ankle, in the foot. All these different areas can contribute to sciatica-type symptoms. As a result of that, hip arthritis, remember the root cause is that imbalance. That imbalance can change the tensions of the nerves in the hip and cause sciatica that's rooted in that muscle imbalance. That's the cause, is the muscle imbalance. I have had so many people go through our hip arthritis recovery program who have said they have sciatica and it improved as a result of fixing the imbalance. So yeah, to answer your question, you can improve it for sure. And because fixing the imbalance means you're taking pressure off your back as well. If you do have a back-related sciatica problem, it's going to improve anyway. So you can't lose in this situation. This program fixes sciatica too. Kristen Martin says, hello, doctor. I was in an accident and my hip was displaced. Oh, I'm 27. Do you have any tips for recovery? Oof. Well, I would go back to fixing the root muscle imbalances, because fixing the root muscle imbalances puts your body in the optimal state of muscle tension that you should be in. And if you had your hips dislocated or displaced, like they're out of position of where they should be, getting the right muscle tension will put the ball back in the socket, will realign your pelvis bones. It gets everything to go where it needs to go. And the thing is, you might be seeing a physical therapist. You might be, hopefully you didn't have any surgery, but if you had surgery, you're going to be recovering from that. There might be guidance on specific exercises and movements to do. And you can obviously do all that stuff, but I would go back as soon as you can to getting the glutes to be active again, to getting your lower abs to be active, making sure your foot muscles, your toe muscles are working properly. I would go back to those basics, the abs, lower abs, glutes, and toes. Those are the big three that help with fixing the muscle imbalances in the feet. In your hips and in your knees. Good comment there. Hopefully you get better, Kristen. All right, we got Deborah, who says, I got a posterior hip replacement, which now I regret after learning about you. I'm so sorry. But last year I could barely walk without severe pain, so I did it. But now I have nerve damage that is bad. Oh no, I'm so sorry, Deborah. That's tough. And I would still say you need to go work on fixing the muscle imbalance, even if you've had a hip replacement. We know that, like something that I talk about all the time, hip replacements don't fix muscle imbalances. They replace the arthritic surfaces of the joint. That's what they're supposed to do. And they're pretty good at doing it. But you can still get muscle tension, nerve tension as a result of the muscle imbalance. And because of the incisions made, which is possibly what happened in your case, Deborah, they might have nicked the nerve, or the way you healed might have put tension on the nerve or pressure on the nerve. Hopefully, my hope for you is that you can still address muscle imbalances, because that's in your control. If you can get stronger glutes, stronger lower abs, begin to move better, use your glutes during walking, keep up regular exercise, I think that's your best shot at clearing up any nerve problems, or at least minimizing them, improving them to the point where they're hardly bothering you, and you can do whatever you want despite having done the hip replacements. Same with knee replacements, by the way, guys. If those of you guys that have had a knee replacement, think of Joe's case earlier. If you were here to hear me talking with Joe, Joe had a back surgery and still got improvements in his back and his hip. So it's possible for you to have a surgery like a joint replacement, hip or knee, and still fix your muscle imbalances and get an improvement afterwards. That's much better, in my opinion, than going back for a revision, a second hip or knee joint replacement. And we even made a program called the Failed Knee Replacement Recovery Program, because we had so many people that have had a knee replacement and we're still having problems afterwards. And we found that improving the muscle imbalances helped them out many times. They can't get, as we've seen, is they rarely get improvements like somebody who hasn't had a surgery yet, because there's permanent changes in their joints if you had a replacement, but they can get improvements enough to say, I don't need another surgery, and preserve what they've got with the surgery they've had. Good comment there, Deborah. Hopefully you get better. When you're feeling pain versus when you're feeling muscle fatigue. I think that's one of the most important things to to realize is that you have to make sure that you understand your body. So what we have happen a lot is people will say they have pain, but it's actually muscle fatigue or soreness. And if you can make that distinguishing factor, then you can tie it to you need to have muscle fatigue in the glutes, in the lower abs, in the foot muscles. Then you can begin to target. This is what the education that we take people through to understand the over time problem. Then you can have independence, like Joe was talking about, where you can own the knowledge. You can get your PhD of how to fix these problems by understanding what you're feeling and knowing when to go harder, when to do more exercise, or when to back off because something's getting worse, something's not improving. So hopefully that helps you out, JB. You just have to have that understanding, and that's how we take people through our program to get them that knowledge. Bells says, I can't walk. Does swimming help for knees? Thank you so much. Greetings from Italy. So sorry you can't walk. Swimming might help if you're using your glutes more. I wouldn't pursue swimming necessarily unless you have a pool at your home or it's really, really easy for you to get to a pool. People say swimming is good for knee pain just because you're in the water and there's something about swimming, but that's not the case. Because if you're swimming and you're using your quads quite a bit to kick your legs, then you're probably going to make the muscle imbalance worse. And just because you were in the water, that didn't heal you necessarily. There's nothing special about the water. What it does is it unweights you. We have people that walk in the pool, or they'll touch the ground, or they'll walk in the pool without touching the ground. They'll just simulate walking, but they can't touch the ground. But you have to be using your glutes because it's a muscle imbalance. So what I would recommend in your case, Bells, is don't pursue swimming. Somebody may have said that to you and put it in your head that you need to get to a pool. Instead, pursue offloading. Get on a walker, get some crutches out. These things here. When you put weight on your legs, make sure that you're putting some weight on the crutch. You need 2 crutches ideally. Or get a walker like this or a rollator like Joe was saying. The rollators have wheels on all 4 points of the walker. It's a walker basically, but see how this one just has wheels on the front versus the back. The ones that have 4 wheels here too, they just roll with you and you can put pressure as you're moving the whole time. This one just makes you go a little slower. But when you put that pressure through your arms and you take it off your legs, usually you can walk better. You can begin to calm down that knee pain. That's why the offloading is so key, and we push it so much in phase 1 because it's not pushed enough. Most people out there, most healthcare professionals, what I'm talking about, most healthcare professionals will never recommend using a walker or doing any sort of offloading when people have knee arthritis. They say take pills, take medications, do the injections, try physical therapy, and then go to surgery. And not once do they say, well, why don't we get on a walker for a few weeks and see if that helps? The first time people use a walker, if you have knee arthritis, is after you've had the knee replacement. It's too late then. So I hope you can get those glutes working and get offloaded, and then maybe you don't even need to pursue swimming. AG says, just to be clear, if you have one hip lower than the other, it's okay to do the glute exercises. Asking because I heard that you have to first align your hips before exercising, or it'll cause wear and tear. Not necessarily. I think you can be uneven in your legs. You can have one leg longer than the other, uneven in your hips. Because I tell people all the time, go ahead. Yeah, you might need to see a manual therapist like me to get yourself straightened out, but it's not going to stay straight. You still have to do your exercises, and you doing the exercises will usually help to align you. It happens all the time that people will do an exercise correctly, like we are letting them know they're using their glutes, and something will pop or shift, and they would have done it themselves. They would have aligned their own body. So I think that's what I would focus on. I wouldn't wait to go see somebody. I would start exercising right now. Unless you consistently can't do the exercise because of pain, I would start doing the exercises right now. And I would venture to say that there's probably an easier version. If you have pain doing an exercise, there's probably an easier version that you haven't tried that will affect you. You might just be tightening your glutes, and that's where you need to start. And some people will get a pop in their back or their hips just doing that, and that'll give them some relief. So I'd say go for it, AG, as long as you don't feel any discomfort. Sherry says, coming in late, how does one know if it's the hip or muscle? What tests are done for either? 63 and losing upper quads, thighs, glute muscles, and worried. Oh no, I'm so sorry, Sherry. I wouldn't look at tests. And this question, I think, let me change your thinking on this, Sherry. If you have hip arthritis, meaning you've been diagnosed by the doctor, you've gone to the doctor, you had the x-rays, and they said, you have hip arthritis. It's right there on the x-ray, bone on bone even, potentially. Then you don't need to worry if it's muscle or joint. It's a muscle imbalance that's causing the joint problem. Even if you suspect you have hip arthritis, because in reality, by the time you get hip arthritis, you've probably dealt with a hip labrum tear or bursitis in your hip or tendonitis. You've had some sort of hip pain prior to getting the actual arthritis that shows up on the x-ray. And so it's splitting hairs deciding on if it's a joint or a muscle problem, because what are you going to do anyway? Go have surgery? Is that going to fix the muscle problem? Maybe it'll fix the joint problem, but what caused the joint problem? It was the muscles. So regardless of whether it's a hip or a joint problem, we need to fix the muscle imbalance, because that puts the joint in the right position and it allows the muscles to behave properly so that muscles aren't yelling at you saying, ow, I hurt, you're overusing me. Start fixing the root muscle imbalance, and it's usually lower abdominals that need to get stronger, glutes that need to get stronger, and toe flexors that need to get stronger. And you need to stop overusing your hip flexors on the front of your hips, your quads in the front of your thighs, and your back muscles, the spinal erector muscles, the ones right against your lower back. Hopefully that can help you out. Sherry, I would encourage you to watch a lot of our videos and go to our playlists. If you have a hip issue, go to the hip arthritis help playlist. If you search in YouTube, you'll find it on our page. And that will begin to get you to think properly about this so that you're not just trying to chase a joint problem or a muscle problem, which happens so often, even amongst medical people. Like people in the medical field have this exact same thought. Is it a hip joint problem or is it a muscle problem? And I'm educating them the same way as I am you guys. I'll just call you L, can't pronounce that. Possible hip labral tear and painful bilateral knee arthritis. What gym machines are good to strengthen glutes without compressing joints? Right knee locks at times, and going upstairs, can't use the left leg. Oh, I'm so tired. I'm so sorry about this. First thing I would say is don't go to the gym if you can't activate your glutes on command. What I want you to do here, L, is sit down or stand up, sit or stand, and try to activate your glutes without your thighs taking over. If you can't get your glutes to 90% or better, like hold it for 10 seconds and tighten your butt muscles. Let me do it on the side camera here so you guys can see this with me. You should be able to stand up and you can put your hands back here and just tighten these muscles up without your thighs taking over. You hold it for about 10 seconds. You can see my muscles flexing here. And after about 10 seconds, you should feel like these are getting tired back here. But if 10 seconds pass and you don't feel as tired back here and it's more here, that's not good. And if you go to the gym to try to do exercises, you're going to be overusing your thigh muscles and underusing your glutes and set yourself up to make this muscle imbalance even worse. And what you need to do instead are some more basic exercises outside of the gym probably where you're better controlling those glutes. We talk about it in our program all the time. We don't really get to gym type exercises until phase 3 or phase 4. So let's make sure that's cleared up first. Now, if you can activate your glutes well, consistently, you're not over dominating with your thigh muscles, what I would look to do in the gym is, number one, I would look to do deadlifts where you have a barbell down here and you're pulling up and you're standing, you're pushing your hips forward like this to tighten the butt muscles, and the focus is the butt muscles. Another one is one that I like to do is cable hip extension. So I have a strap that goes around the ankle and it's got some metal loops on there, and you hook it to the cable machine where you have a stack of weights and you pick your weight, and then you're standing on one leg and the other one you're kicking it back like this, trying to flex this muscle. You're repeatedly trying to come back. And what I like to do to make it a little more intense on the glute is when I come back, I'll turn my foot, you can see my toes, turn the foot outwards like that and angle my knee out a little bit because that makes the glutes tighten up better back here. And I'll move slow to make that muscle burn back here. And I'll usually do plenty of weights, plenty of reps with the right weight. The weight, I'm not too concerned about. Sure, heavier weights is better, but the heavier the weight, if we're talking any gym exercise, the greater the chance that you're going to compensate with other muscles. So I'm a fan of, I'd rather you do lower weight and higher reps because you can concentrate better on using the right muscle versus if you're doing higher weights and lower reps usually, then you're straining a lot to just pick up that heavy weight and you can't concentrate on using the right muscle as easily, which then puts you in a situation where you're going to use the wrong muscles and feed the muscle imbalance inappropriately and increase that pressure over time in your joints. So you got to be careful with those gym exercises. Make sure that you earn the ability to go to the gym by first being able to consciously activate the right muscles, the glutes in your case. And even with that labral tear, you can improve it. A lot of times people with labral tears don't need surgery. You just need to fix the muscle imbalance. That's what leads to hip arthritis very often. Dr. Lyons says, very helpful. Always get reinforcement and encouragement here to keep going, no matter how inconvenient these changes seem. They can seem inconvenient. It's tough. We get comments from people all the time that say, you want me to use a walker? I have to live my life. I have to walk places. I have to go. I work. And you want me to use a walker? And my answer is yes. Yeah, it's going to be inconvenient to have a surgery. You might as well go through the inconvenience without the full brunt of it, without permanent changes that you can't undo. And I'm not getting mad at you, Dr. Lyons. I'm just going on a general rant here. I know you get it here. You've been here for a while. We've chatted here and there. But this is what I have to tell people very often is you got to think about this straight. You got to think into the future what's going to happen if you end up having this joint replacement. You're going to be on a walker for a long, long time, potentially the rest of your life. We see people all the time that never fix the muscle imbalance. They don't have any education on that whatsoever. They get the joint replacement. You get weaker automatically after having surgery because they cut through stuff and you're on bed rest for a while. Sure, they get you up and moving, but you're not moving like you were before. So you lose a lot of strength. And if you're not of the mindset of I'm going to gain my strength back, then people just stay at a lower strength level, reliant on that walker, and they never get off. Some of you guys might have parents in that situation. You might be in that situation. You have to use a walker, otherwise you're going to be falling. Why not use the walker now to offload and get that joint better, and you're just going to be using it for a week or two, maybe a month or two. Then you get your muscles working right, and you're only inconvenienced for a short time rather than giving up the rest of your life and giving up a lot of independence the rest of your life. So, guys, you got to look at this at the long term to realize that this short term, problem you're going to have with a walker is not that big of an inconvenience compared to the long term if you have the surgery. Mimi says, I am a member of the HIP program. Awesome. Recent visit with the ortho provider. I was told despite severe bone-on-bone plus bone spurs, my exam results led him to say no surgery recommended at this time. Awesome. Fantastic. That's great. Testimonial here from Mimi. She's been in our HIP program and her visit with the ortho doctor, with the orthopedist, the surgeon, that she's good to not have surgery despite being bone-on-bone and having bone spurs. This happens all the time. I tell you guys, more than half of the people in our hip arthritis recovery program and our knee arthritis recovery program, we're told they have bone on bone, and they're getting better like Mimi. Good job, Mimi. Kudos to you. Fantastic. Thanks for sharing that. Dr. Lyons says, preaching to the converted here. Converted, yeah. Preaching to the converted here. Yep. I know. You guys are here.
Okay,
You
last
guys are
comment.
getting it. All right, we got two comments here.
Last comment.
Oh, last comment. I'm so sorry. We're going to wrap up. Cindy Knight says, I saw a friend. She says, just go get the hip replacement. Best thing ever. She walks like a car with a flat tire. Really, that is not what I want. And then she says, every show is educational, not to mention encouraging. Thank you, Dr. David and staff. All, of course, you're welcome, Cindy. That's great. Yeah, this happens all the time where people are like, the best thing ever, and they're all, they're walking not that great. And those people, they I think their expectations of their health is just a little bit lower than I think you guys here that are with me. You guys have higher expectations. That's why you're doing this research. That's why you're committing this time in the middle of the week to learn about this stuff, rather than just fully 100% trusting the medical system. And you guys suspect there's a way, and I'm giving that to you here. There's a way to avoid a hip joint replacement. And so, you guys have to learn. You guys have to realize that there is the possibility for you to walk great without having surgery. So I think you're going to get that, Cindy. You're here learning that stuff. So congratulations to you for committing the time and effort. Let's get there, guys. Hey, y'all, thank you so much for joining me this week, this Tuesday afternoon. I look forward to seeing you guys next week. Y'all have a wonderful week. Bye, everyone.